Good evening, ladies and gentlemen. My name is Clifford Jean-Jacques. I'm 38 years of age and I have sickle cell anemia, SS to be exact. I'm here today just to basically let you guys know that what's going on with me as far as the whole sickle cell and a couple of my stories that I basically have encountered throughout the 38 years that I've had with sickle cell. And I'm gonna go in depth with talking about. I'm not gonna say the name of the doctors, but I will tell you what institution, as far as hospitals, that I've gone through that I've got the best care, and also let you guys know what's going on with me. So we're gonna start. If you're new to the channel, go ahead and subscribe and tell you I got stories for days. So we're just gonna go into one. So it's 2005. I'm at Florida Atlantic University and I have to get gallbladder removal. I had to get my gallbladder removed. And you guys know if you do have sickle cell, you either have to get your gallbladder removed or your spleen removed. Me, I had to get my gallbladder removed. So therefore, I ended up finding a doctor through my hematologist, and basically they referred me to him. So when they did refer me to him, I went to go speak to him, and when I went to go speak to him, he basically told me prior to me going to see him, I advised him that I was basically going through exams, so he told me that I had nothing to worry about, that it would take just one day for the surgery, which is done laparoscopic. It's laparoscopic. I say laparoscopic all the time. If you guys don't know what laparoscopic is, it's basically a laser surgery. So they did laser surgery. So I went in and I told the doctor, yeah, so they put me under. When they did put me under, I went in and they did the surgery. And then when I was done, everything was okay. I felt normal and I wrote myself out, getting ready to go home, go back on campus, start studying for my test. But guess what? That didn't happen. So prior to me signing the paper and everything, the doctor, again, he said I was ready to go. So I took, I asked to use the restroom. So I did go use the restroom. And when I went to go use the restroom, now this is people telling me what happened now. I went to go use the restroom, and as soon as I finished using the restroom, all I know is when I woke up, I was in a room, hands just full of everything, just like you would see in the movies. IV is running, units of blood is running through one arm, and another, they're giving me antibiotics and the whole nine. So I'm asking what's going on. So they told me that I fainted in the bathroom. Thank God I had my parents with me, both my mom and my dad. So they did what any parent would do. They told the doctor, what's wrong, what's going on. So the doctor told him, well, he has sickle cell, and basically it's, that's liable to happen. All right. So if you do go to the hospital, every morning they take your blood. They do, the phlebotomist comes in and take your blood, do a H&H to see what your H&H is, which is your hemoglobin. A normal person's hemoglobin is between 15 and 20, I believe. And people with sickle cell, it runs in the low. I'll take myself for example. The lowest mine's ever been is 4, and the highest is 15, 16, which is now. And I'll tell you guys how I got to that part. So therefore, they did take my blood prior to giving me at least couple units of blood. So my blood count it kept, decreasing. It kept going down, going down, going down. So I'm asking myself, and my parents are asking me, how do I feel? I say, I feel like trash. So basically, they call the doctor. This is 24 hours after now. So the doctor, my parents, they told the doctor, they said, well, do a CAT scan. And he refused to do the CAT scan. It's like, well, we'll give him more units of blood and see what goes on. He kept giving me blood transfusions. Took my blood again in the morning. Bam. Same thing. Nothing has changed. So now, my mom, she swerves different. My mom, she just swerves different. Both my parents, they swerve real different. So they both ask to speak to the head nurse, and they tell the head nurse to call the doctor, tell them that we want a CAT scan. And the doctor didn't want to do the CAT scan at first, but they managed to get it done. So they got it done, and as soon as they did the CAT scan, what happened, they saw that I was bleeding internally. So by me bleeding internally now, so they call a doctor. They call a doctor. The doctor's at Good Samaritan Hospital in the West Palm. If you guys are familiar with Florida, West Palm. I was at St. Mary's Hospital, by the way, in West Palm. So the doctor is in the operating room doing the same procedure to another patient. So therefore, the doctor, as soon as he's done, he rushed to St. Mary's Medical and go ahead and tell my, he gets to the door. Now I vividly remember that day. My dad's hand, it was balled up. But my mom, calmed them down. My mom was like, this is what's going on. So, let's get it done. 48 hours now. I'm going under again. So they go ahead and open me up in the abdomen. In New York, back in New York, I was raised in New York, so we call it a $150. So I got a scar on my abdomen from the surgery that they did, so they could go in and go ahead and do cross the T's, dot the I's to get me back right. So I stayed in the hospital for probably 48 more hours. So now we're talking at 4 days, and exams was coming up. I felt like crap, but they let me go home. And then going home, it was hard for me to walk because I have stitches. Had at least 15 to 20 stitches and a big band-aid across the chest. So I'm like, all right, it's a wrap. It's done. So with that being said, I get home. I'm not feeling good at all. I'm still feeling kind of, not myself. So we go back to the hospital because that's what they say. When you leave the hospital, they always tell you if something persists to come back to the hospital. So I did that. I went back to the hospital, and us people with sickle cell, like we know exactly if we do not feel good, we have to go to the hospital. And I vividly remember that day. I went back to St. Mary's, exactly where they did the surgery. So I get there, and we get to the emergency room. This doctor that was at the emergency room, hey, if you looking, I didn't have all that hair, all right? I didn't have all that hair. So I'm pretty sure you'll recognize me. If you do, go on YouTube and check me out. The doctor's Caucasian, and the doctor that did the surgery, he's black, African American, I believe. So I'm at the hospital, the emergency room. I tell the doctor, what am I here for? I'm here, I have sickle cell. And again, as soon as you get to the hospital, we say we have sickle cell. Hey, this is what they say. Hey, we have a sickler. Stop calling us freaking sicklers. At least me, I do not like that name sickler at all. Sickler sounds like a peon, like a roach or something that bugs you or something like that. No, I'm a sickle cell patient. I'm a person with sickle cell, a human being with sickle cell. So do not call me a sickler. No, if that's the word you use, take that off the dictionary. So as soon as we get there, so they get me into a room and everything, and I vividly remember again the doctor saying to the nurse, and they think I didn't hear them. Yeah, he was just here not too long ago, so he's probably med seeking. Yeah, they think we med seek, and I'll talk about that. So they take me to the room. hooked me up, put me on IV fluids and everything. So finally the nurse comes in, and we all know as soon as the nurse comes in and say, okay, yeah, I'm coming with your pain medication. So that's exactly what they said, and they basically gave me the pain medication. And again, end up finding out it wasn't pain medication. Because what happened is the doctor basically thought I was med seeking. He basically, because I'm a CRA, I'm a certified recovery advisor. Uh, I deal with people with substance abuse. That's one of my jobs. I wear many hats. Not trying to brag or anything, but yeah. So therefore, Narcan is basically what they give to people when they're ODing, overdosing. I use ODing as overdoing. But when they're overdosing, they use Narcan. They hit them with the Narcan to bring them back to life. So that's basically what the doctor ordered. When he ordered that, soon as it hit me, I felt lousy. I wanted to throw up. It was bad. It was bad. So now, doctor comes in later on. He's like, oh, "Did you like what I gave you?" I'm looking at him like, only if I wasn't, hooked up to this. And I'll always remember that doctor, yo. I will always remember that doctor. He was wrong for that. He was wrong for that, for not telling me exactly what kind of medication that he was giving me and how he saw me as, you know, we all go through that, people with sickle cell. And again, so I left the hospital, came home, and mind you, I said I had exams due. So exams didn't get done. I had to get MWs for the whole semester, which is medical withdrawals, for the whole semester. I ain't even get my money back, but it is what it is. That's another story. But yeah, so I went ahead and did that, and so I will never forget that doctor. Never forget that doctor. Ever forget him. So with that being said, this is what I want to bring to the table. This is the talk about us people with sickle cell. They label us as sicklers, which I do not appreciate, and neither should you. So we're sickle cell patients. So when you do go to the hospital, tell them exactly what's going on, how you feeling. And again, when they ask you what's your pain scale from a scale of 1 to 10, please do not say a 11 or 12 or 20, because nurses do not know that. They know the pain scale from 1 to 10. All right, this is a nurse that's informing me on, when they say that they have a 12, we don't understand that. Just stick to the 1 to 10, because that's what they know. So when you go to the hospital, just let them know exactly what's your pain level, and they'll, do what they do accordingly. And again, doctors are supposed to be there to treat and do what they have to do to us that have sickle cell and make us feel better. And again, they have people with sickle cell, and the truth needs to be brought to the table. They have people with sickle cell out there that does go to the hospital when they do not have enough medication, and they just want, a little bit of the medication in their veins in order to feel that, high. And that's making other patients with sickle cell not seen as credible when they go to the emergency room because of what other people with sickle cell are doing. And again, I suppose that when you get to that level that you feel that you have to do that, you have to be real honest with yourself and say, you know what, I have a problem with pain medication and I need help. Now, it comes back to me. Is that what I did? No. I went to the doctor myself. I told the doctor I did not want to be on pain medication. He basically referred me to a doctor, and basically the doctor was really nice. Again, I want to say his name, but I don't have his consent to say his name. So I won't say his name. Very nice. I went to the hospital, and he basically looked me up and saw exactly